Next, we're going to look at the shoulder and arm of the cat. Now, the first thing you should do before actually getting into the muscles that we're going to be looking at specifically is to remove a muscle way up top here on the superior aspect of the shoulder. This is the clavobrachialis, and you will have to cut some pretty thick connective tissue to move this muscle away. You'll also probably see a vein. Feel free to cut and get this out of the way. Okay, once you've done this, once you've removed the clavobrachialis, which is again a muscle you don't have, but cats do, we're going to look down to the rest of the arm. Let's start with the triceps. So the triceps are 3 muscles, hence triceps. 1, 2, and a third, that's medial. And these are going to grab the forearm and extend it, like so. So this is going to be the triceps group. So let's isolate these muscles. Now the first one, you're going to find sort of a divot, a groove right here. Slide your forceps or scissors underneath it, and just try to find the border between them. And there we go. Now, once you separate them, and this is a little bit ripped, but I'll try to do my best to keep these in good shape. What we'll have are 2 of the 3 heads of the triceps. You'll notice this one is massive, and this is the long head of the triceps. The one right here next to it is the lateral head of the triceps because it's, well, lateral. The third and medial head of the triceps is actually not visible here because we're looking at the lateral arm. Now if we peel this out of the way, you'll be able to find the medial head underneath, but you're not going to be able to see this on video especially well. Okay, next, so now we have our 3 triceps muscles, and I'll further isolate this as we go. Our next muscle groups are going to be the deltoid muscles. There's one here called the spinodeltoid. You can sort of see it here as I pinch it. This is not something that you need to spend a lot of time isolating. It's more of a stabilizer than anything else, but it's right here if you want to take a look at it. You'll be able to find that on your cat. The muscle that we're going to really concentrate on is this deltoid, specifically the acromiodeltoid. Now, deltoid means the letter delta in Greek, which is sort of the triangle, equivalent to our letter D, but a triangle in Greek. And I'll try to isolate this as best as I can. And this is going to be the muscle that takes the shoulder and pulls the arm out, abduction. This is not the easiest muscle to get underneath. As you can see, this is going to be a little tricky. Whoa. The origin and the insertion are pretty close together, so you're not going to free it completely. Do the best you can to isolate this muscle. There we go. There's a quick and dirty job of the deltoid, the acromiodeltoid specifically isolated. Let me try to pick this up so you can see it a little bit better. There it is. Origin over here on the scapula, insertion on the humerus, used for abducting the humerus. Next, at the end of the deltoid, right at the insertion of the deltoid, is the origin of another muscle, which is found right here. And this is called the brachialis. This is actually the most important muscle in your body for flexing the forearm. So we tend to think of it as the biceps muscle that's most important for doing this muscle, but the brachialis is actually more important in most angles of this flexion motion. So I'm going to try to isolate this a little bit better. Now right now it's pretty closely attached to this triceps muscle, so I'm just trying to get underneath, get a better angle at. As you'll notice, this clavobrachialis muscle is in the way as usual. We'll have to do our best to isolate this muscle away from the other tissue. Here's our brachialis. Now to really get a good view of the brachialis, you'll have to isolate the triceps especially.